We're going to get invited.
Good morning. I am here with Dr. Threadgill from Community Health Centers of Pinellas. We're here talking about community testing around Pinellas County and the testing sites that Community Health Centers of Pinellas is operating. Today we'll ask some questions and have a good conversation about the testing here in the county. Hi, Dr. Threadgill, how are you today?
Good morning, Ashley. So glad to be here and happy to be here on behalf of Community Health Centers of Pinellas.
So what is Community Health Centers of Pinellas and what's your mission?
Community Health Centers of Pinellas is a patient-centered medical home, which is kind of a long name for a great concept, right? So that means that we provide primary care, and we provide primary care in a holistic way, so that we're looking at patients and the patients are the center of our care. We provide services in a various number of departments and specialties, and so those include pediatrics, family medicine, dentistry, OBGYN, we have chiropractors, we have pharmacists, we have a pharmacy on site, nutritionists, behavioral health, which is something that, during times like this are certainly very valued, and a myriad of other services within our organization. Together, all of us join together to really provide the best care and really a holistic type of care for our patients.
And one of those services is now COVID testing.
Exactly. And so COVID testing is one of the things that, we jumped in as the county really needed someone and somewhere to go for testing. Coronavirus, is an epidemic and it sweeps our patients, our citizens, our communities. And so really identifying the prevalence of the virus, knowing who has the virus certainly makes a difference as we want to open up and we want to resume services and we want to, kind of get things back to some semblance of what we are able to relate to. In order to do that and do that safely, it's important to know who has an infection. And so testing is a great part of that.
So one of the questions we already have is, where can someone get tested? And are you guys doing antibody testing?
So you can get testing at 4 of our locations. Right now we have testing sites at our location in South St. Pete at Johnny Ruth Clark. We have testing in Pinellas Park, Clearwater, and at our Lillman or over at Lillman Exchange, so over in the Lillman area. We are currently doing diagnostic testing. And so that is testing to identify if you have coronavirus. We are not doing antibody testing at this time.
What should someone know or do before they go to a CHHC testing site?
Yeah, so we certainly recommend pre-registration. And so calling in or going online, requesting the appointment certainly helps to expedite the visit. And so you can pre-register, complete all of the registration paperwork, and then set up the day that you'd like to do your follow-through for the visit. But we also accept walk-in drive-ins. And so we have lots of patients and lots of people who just decide to come into the center. And of course, they are always welcome as well. There is some registration paperwork that's required, as well as a telehealth visit with one of our doctors or providers. And then we are currently performing nasal pharyngeal swabs. And so the specimen is collected and then you're all set and on the way.
So if someone doesn't have transportation, they can just walk up to a site that's close to them?
They certainly can. We have areas for walk-ups and areas for unscheduled drive-up. And so we welcome all. We really want everyone to feel that if they want to be tested, we are there for them to do so.
Okay. When should someone decide to get tested? Just on a whim, or should you wait till you have symptoms?
Yeah, so we're testing patients who are asymptomatic and symptomatic. And again, I think that the greater concept, it really is, how do you identify the prevalence of this virus in your community? And we know that many patients are asymptomatic, meaning they don't feel sick. They don't have a fever. They may not have traveled out of the country, but they may still have the virus. They may still shed the virus, which means they could be a source of contagion to others. And so while our test does test for a moment, right? So it's testing for the now, it at least gives that bit of information that, really kind of helps you to identify whether or not you may have the virus or not. And so we don't recommend that you have to wait for symptoms. If you'd like to know whether or not you have it, or if you're having symptoms that a lot of us would think maybe are just mild, I'm just having a little sniffles, or I'm having a little sore throat, or I don't smell as usual. Usually I can smell everything, and for some reason that's a bit muted. Sometimes those are symptoms of coronavirus. And so, that's a good opportunity to test.
So I've decided to get tested. I'm going to head over to a testing site near me. What would I expect when I arrive to a Community Health Centers of Pinellas testing site?
Yeah, so you'll be greeted by one of our amazing staff members, and they direct you depending on the services that you need. And so if you pre-registered and you've already had your telehealth visit, then you go directly for testing. You're given some instructions, of course. We want to make sure that you're aware of what the test involves and what to do post-testing, right? So after you've gotten a test, certainly there are recommendations. And so you're provided all of that information, and the visit is really fairly expedient, and it really allows you to get testing without a large intrusion in your day.
Awesome. Are there any fees for this testing? Am I going to expect a bill in the mail afterwards?
No, the testing is done. So we accept all insurances, and if you're uninsured, we will do the test without cost.
And what type of COVID test does CHC perform? Are there different types of tests at different sites, or is it all the same? Is it going to be throat swab, nasal swab? Can you walk us through that?
Yeah, I think that's a great question, because that's one of the things that patients worry about. We are currently doing the nasopharyngeal swabs, which I can tell you are not the most comfortable things to happen in your life. Not the worst, but not the most comfortable. But it is a test that has good accuracy, and we want to make sure that when we are performing the test that it is as accurate as we can be. And so the test involves using a swab, which is placed into your nasal opening and goes back to your pharynx. And so it's a nasal pharyngeal swab. And specimen is collected, and that is then sent to the lab for processing.
How long should I expect before I get my test results back?
Mm-hmm. So right now we're getting test results about 5 days is what we're saying on average. We send our tests out for testing and analyzing, and so we use commercial labs to do our testing. But about 5 days is the average.
And can you go through where those testing sites are located again? And when's the best time to go? Early in the morning?
Yeah. So our testing sites we have one in South St. Pete at our Johnny Ruth Clark location, 1344 22nd Street South. Now, I'm not going to remember the address for everyone, so I shouldn't have started that. But in South St. Pete, we have a testing site at our Pinellas Park location. We have a testing site at our Clearwater location on Druid Road, and at Lilman Exchange. The hours, so this week we have some special hours because of the holiday, but in general our hours are 8:30 to 1:30. And during that time we are doing our testing throughout that time, and so that would include those who have already had their visits, as well as those who walk up and drive up.
Is there anything else that the public should know about COVID testing and what you guys are doing, or how important is this for our community?
Yeah, I think that what we all know that we were kind of struck with coronavirus in our communities, and it really changed the way that we did everything from school to work to shop to leisure. And so, one of the big tools that we have as far as when do we resume, when do we move back to services, is really identifying who has the infection. And so how do you do that? It's through testing, it's through contact tracing, it's through isolation. The tests are important for several reasons, right? So not only do they identify who is sick, right, who has the virus, but it also helps to identify those who they may have contacted. And it helps that person who is feeling sick change behavior, right? There's a lot that goes into how you feel. And so if you have a little sniffle for a day, and then the next day you feel, okay, you may be inclined to run out to the grocery store or now go to the mall or do something along those lines. But if you know that you actually have coronavirus, that changes the way that you behave. It helps you to be respectful of others. It helps you to be mindful that you could be potentially spread the infection. And so instead of doing those casual things, isolation becomes a little bit easier, right? And so then you are able to isolate, you're able to protect your community. And so it's isolation, it's contact tracing. So then you can identify people that you may have had direct contact with so that they too can be tested. And those that they've had contact with can be tested, which then helps to limit the expansiveness of the virus, because it is a contagious virus that can easily spread. And so we want to make sure that the decreased risk of it spreading to more people, we want that to be a smaller risk.
Absolutely. So testing is definitely vitally important. So if I think I was sick in December, and I get tested today, will that test that you guys are doing, will that show that I'm positive?
It very likely will not. The test that we're testing looks for acute infection, so active infection. It does not look for historic infections, right? So if you've had it in the past and recovered, then you likely will not still test positive for the infection. But again, what we find is that there are lots of people who don't feel sick at all, but because the virus is prevalent in our community, they could be one with the virus and spreading the virus. And so while you may have no risk factors and a strong immune system and you're doing fine with it, your neighbor, someone who lives in your home with you may be more vulnerable, may have an immunocompromised condition, may have other risk factors that they may not do as well. And so testing and identifying the infection really makes a difference when we're looking at community spread and public health. Of course, we always continue our general safety practices. We wash our hands. We use hand sanitizers. We isolate and distance ourselves. We avoid large crowds when possible. And I think that one of the most important tools that we have is we wear masks. And we know that wearing a mask really does help prevent the spread of respiratory droplets. And so if I'm wearing a mask and someone else is wearing a mask, the risk of spreading an infection certainly goes down, significant enough that it makes a difference to wear it or not wear it. And so we certainly want to encourage everyone to continue doing those things as well.
Yeah, definitely. So if I get tested and a test comes back positive, should I be telling my friends and family that I've been in contact with to go get tested as well?
Yeah, I think it's important to let everyone know who you've had direct contact with that you tested positive, because again, they may not feel sick, but they could still have the virus. And if they then, reach out to others, it could spread. So it's certainly a good idea to notify those who you've had direct contact with, because testing really is important. The test is very quick, not the most comfortable, but very fast. And, it's very valuable. And it really does give you that information that you need to protect yourself, protect your family, protect your friends, protect the public.
Very important. And especially those that are vulnerable around us. Very important.
Absolutely.
Can you walk us through again, kind of from when I call to make an appointment to getting my test result? What are all the steps that are in between that's involved with Community Health Centers of Pinellas testing site?
Right. So when you call to make the appointment, you're given a day that you'll receive your telehealth call. And on that day, you'll receive a call from one of our doctors or providers who will call and discuss just kind of your risk factors, go through some of the information, give you a little bit of information about COVID testing and coronavirus in general, ask some health history questions, etc. And then you are placed on the schedule to go to the drive-through. And you go to the drive-through, and upon arrival there, the team will verify your name. So you would want to have your ID, your driver's license or your state issued ID. The team would verify your identity, and then they could proceed with testing. Testing involves the nasopharyngeal swab, and then you're given some instructions and discharge instructions. We also provide some information on logging into our patient portal. We do have our results posted there in our patient portal, and so that's an easy way to access the lab results as soon as they're available.
Say I don't have access to internet. Is there a way for me to get my results?
Sure, you can always contact us at the center, and we will be able to provide them. But you know, our goal is, one, we don't want you to have to wait for us. We want your results to be convenient and easy for you to grab. And you know, right now, a lot of workplaces, businesses, etc., would like to see your COVID results if you're scheduled for procedures, or if you have jobs that involve, you know, direct exposure to other patrons or other people. A lot of employers are asking for the results of recent tests. And so through that patient portal, you can download the results, you can print the results, you can show the results. And so it really just makes it very convenient when you utilize that resource.
So that patient portal is really important to use.
Very helpful, I think.
How do I know that going to a Community Health Centers of Pinellas testing site is more legitimate than maybe I see a tent on the side of the road with somebody with a swab out? How do I know that maybe that one site is more legitimate than the other?
Well, you know, I think that Community Health Centers of Pinellas is known for the quality of care that we provide. We take numerous steps, and numerous is probably not a big enough word, to make sure that what we do is done in a safe way. We make sure that what we do is in a very efficient way. And so that I think that if you come to Community Health Centers of Pinellas, you know that you're getting the quality that we provide and the quality of care that we provide. And so that carries right into this community-wide testing that we're doing. We use products that, you know, that are necessary. We make sure that our teams are trained and know how to do the task at hand. And so I think that we bring that level of quality to testing, and so that you can feel assured that all measures have been taken to ensure that your testing is done properly and that your results will be as accurate as one would expect.
So say I'm watching this and I'm from out of state and I'm not able to come to Pinellas County necessarily and get a Community Health Centers of Pinellas testing site and get tested for COVID-19, but I'm looking for a testing site near me. What would be some warning signs of something that doesn't quite, you know, go to par and isn't really up to snuff? What are you guys doing that you would say, you know, if this isn't happening, then that's definitely a warning sign, and maybe you should look for something very legitimate?
You know, that's a difficult question for me to answer. I would assume that if you're not in our state or not in our area and someone else is providing community-wide testing, they would also adhere to standards. You know, I think that it's always important when you're seeking care to, you know, maybe look at the website of the organization and look at who's hosting the event. You know, a lot of places really don't have testing, and testing is not available. So it's certainly something that a lot of people demand. But I guess with anything, you just want to be careful of your source. it is certainly helpful and, really kind of a great thing for our community to really have a trusted source like Community Health Centers of Pinellas. We've been around, for years and years, and, we provide services. We do provide services to patients in our communities, and we've been in the community for a while. And so we bring that reassurance maybe that others may not be able to do, but,
yeah. So if I go to a site and they're not, wearing gloves, or they're not wearing a mask or a face shield, that should probably, be a warning sign. And at the end of the day, just make sure that you're looking at the source. And one of our great resources here is Community Health Centers of Pinellas.
Yeah, I mean, I think that you want to make sure that everyone is being safe and taking all precautions that are expected.
Awesome. Is there any other questions or comments that you'd like to add? Anything else about testing and what you guys are doing over there?
Well, I think that, again, I can recite my message, which I think is really an important one for our community. And it's really that testing is important because it does help to shape behavior. It changes how we act and interact. It helps us to identify the prevalence of this infection in our community. And that helps us as we move forward with reopening and resumption of services. And so I think that identifying how prevalent the virus is, how prevalent the condition is, really can help our leaders and those who have to make the decisions of what services to open, what to make available, how strict should rules be. That data can help them to make those decisions. And I know that our leaders are using data, community-wide testing results and things of that nature to determine best steps for the state of Florida. And so I think that testing lends to that data and really helps them as they're trying to make the best decisions for the citizens of the state.
Yeah, it looks like we have a couple more questions in the comments. How reliable is the test, the actual test swab that you guys are using? Is it very reliable? That if it comes back and it says I'm positive, I'm absolutely positive. Is there any wavering from that?
Yeah, so that there has been a lot of discussion recently on testing, and so I'm happy that someone asked that question. We're using the nasopharyngeal swabs, which really are one of the more accurate versions of the test. And the test is very accurate, provides us information that a positive really is a positive. And so we do feel very assured with the testing that we use that our results are accurate. There are other versions of testing that the accuracy may waver, but the ones that we use, we do have confidence that our results are accurate.
So what I think you're saying is you're definitely using the most accurate of what's out there that you can.
Sure.
Awesome. And I know some people are thinking that maybe it's not worth it. I know that I feel okay, and I could be tested negative today and test positive tomorrow, or test positive today and 2 weeks later test negative. What's the point? Why? And I think you've gone into a little bit, but just want to reiterate for those that are saying it's not worth it, it's pointless, right. I don't need to get tested.
Yeah, and I think that if you are exclusively isolating, which we've done some versions of isolation for a while, and as we all know, it is extremely difficult to do. And so if you are going outside of your home, if you're engaging with other people, if you're going to businesses, if you're going to recreational events, if you're going, if you're doing things that you could potentially expose someone, then I think that knowing whether or not you have that virus certainly makes a difference. It makes a difference on who you interact with. Do I go and visit my elderly grandparent? Do I go and see my newborn grandchild? Things of that nature. Knowing whether or not you have coronavirus certainly helps, again, shape behavior. It shapes what you do, who you interact with. And so, I think that even though you feel okay, certainly there's a possibility You're absolutely right. The tests for the moment now, and could you have a negative test, then I go out to some recreational place, get the infection, and then get sick? Always possible. But, it's very important to know kind of where you are and what your status is as you make decisions on what you'd like to do.
And not just individually, but as a whole, to see kind of the bigger picture of our community and how many people have had the virus or may have the virus at any snapshot in time.
Absolutely. Yeah. I think that certainly makes a difference in how we meander throughout our city and how we feel about it, right? Because I think that we all want to feel safe. We want to resume things, but we want to do it safely. And so in order to do that, knowing the prevalence of the virus in our community really helps us to move forward and know that we're moving forward in a safe way.
Well, this has been some great information, Dr. Threadgill. I really appreciate you speaking with us today. Thank you so much for all the information that you've given. If anyone has any more questions, we'll be monitoring the comments, and this will be up and live on our page, and I'm sure shared with y'all as well.
Thank you so much.